price of medicine.
Welcome to Medical Malfunction, and today I'm going to give you a few tips for an MRI. They are probably amongst the most popular imaging study. It's usually not the first line imaging study, but it's a really good imaging study if you can get one. So first, you got to make sure that you're approved for that MRI. Work your way through those prior authorizations. I know I've had a few hang-ups with those, especially with my current diagnosis. I don't know why they're so difficult sometimes, but yeah, I've had a few delays with the MRI prior authorizations in this breast cancer diagnosis. Seems kind of weird to me, but whatever. I got it done, and I'll tell you that usually that's with the nurse navigator, and working through that with my employer, nurse navigator on the health insurance side is how I've managed to push that through. So there's that little tip for you, and we talk more about that in the nurse navigator section, so make sure you give that a listen on how to make the best use of nurse navigators. But today we're going to talk about the MRI itself. I have a few tips and tricks, because I'll just tell you, back in the day, I had some of those early MRIs when I could get in the smallest tube for the longest time, no problem, no issues. But these days, I'm way more claustrophobic. As you get older and you've actually had some issues come out of those MRI results, you tend to get more medical anxiety. You tend to get more claustrophobia. Forget about it. Nowadays, it's a whole different ball game. I'll just let you know. I've got to have more sedation. I've got to work through those things in advance. So if you have claustrophobia, or you don't do well with an MRI, you got to plan in advance, coordinate it with your providers, make sure that the sedation is ready when you get there. Plan for your driver, whatever logistics you need to set up, find out what the requirements are, and then show up with all your little duckies in a row. When you get there, so now we've dealt with the prior authorizations, we've dealt with the sedation if you need it. All those need to be prearranged before you get to the appointment. Now, the thing you need to know about an MRI is the M. Magnet. It's a magnet. That's what the big M stands for, and it's a big freaking magnet. So whenever you're choosing your MRI facility, I'll just tell you, it really does matter as far as like the quality of the MRI, who's reading the MRI. Your insurance is going to give you authorization, yes, and pay for it. If you don't have great insurance, or you don't have any insurance, ask in advance for the cash pay. Sometimes it's cheaper than your copay. Doesn't hurt to ask, find out. Get the best quality facility that you can find. Don't try to get your MRI done at the strip mall if you can help it. I mean, don't get me wrong, there are some strip mall facilities that are great. They're there for convenience, and they might be part of a really good health system. So when I say that, I'm being a little bit facetious, but really try to find the best possible facility for what you can afford, because sometimes those MRIs are going to be the best imaging study you're going to get, depending on the condition that you're trying to get seen about or get diagnosed. So, and do everything you can to get the best possible imaging study done while you're in that MRI. Follow all the instructions, hold still, and also don't put a butt plug in your butt. I don't know why this happened, but I was listening to a podcast the other day, and this is, okay, not even a joke. It was a woman. A woman went into an MRI with a butt plug in. I have no idea why she did that. I did not follow up on this story, but she did that. And because it's a magnet, let me just tell you, that thing came out the hard way. It came up through her stuff. I'm not even going to go there. Don't put, they tell you not to wear any jewelry, no metal, no rings, take your piercings, whatever you've got. I don't think they put that in the instructions. I've never read those instructions. I think they just assume that you won't show up like that. Don't do that, okay? That was the craziest story I ever read, I think. I've read quite a few, but that was a new one on me. And that was a woman, just kind of made it even more sideways. But yeah, just don't take any chances with this big old magnet, because it can do, whatever questions they ask you on the pre-screening too. Be as honest as you can, because It's metal. It's going to pull metal things out. So I don't think that this was an expected thing. So, okay, I guess that's going to be a new question we're all going to have to answer now. We'll have to find out next year if that's the case. But the other thing to know is when you're dressing for the MRI, you know, wear sweatpants. A lot of places will make you put on their outfits, but a lot of places don't. So the last thing I'll say is wear sweatpants or leggings that like don't have any metal on it, you know, t-shirts with no metallic threads, no anything that you might think about, even like when you're going through TSA, you know, it might be a good guideline, you know. And for me, I tend to bring things like a little face mask or a washcloth, something like that, so I can't see the lights changing. And then they always have, you know, music they put in your ears, and I'll just tell you, it's a little embarrassing, but I usually pick Britney Spears. I don't know why, but that's the thing that will usually get me through the MRI test for whatever reason. It's just not that I'm even particularly a fan in any way. It's a little bit earlier or post-generational for me. I don't know. But that's usually the one I pick. It's music that I kind of know, but I won't get too wrapped up in. And it just sort of like is usually a little bit peppier, and that's just the thing that I pick. So that's my little tip and trick for music choices, because I found that when I pick things I really like, then I don't know, it doesn't quite focus me in the way that I want when I'm in the tube. So yep, so I have my tips and tricks for MRIs, and I'm sure everybody else has got theirs. I try meditation, I try this, but I will tell you this, I don't do it without the sedation these days, because otherwise I'm coming out of that too, whether you want me to or not. And once I get all that authorization paperwork in place, I got to make sure I get through that test and without damaging any equipment, because I don't like it. I don't like that too. But those are my tips and tricks for getting an MRI done. So if you've got some, please share below, because I think that will be something that a lot of people will like to read about, because MRIs are obviously, and when they say open MRI, I'm just gonna step out there and say it is not as open as you'd like to think, especially if it gets in your head, because there's just nothing you can say to convince me that anything is not. I mean, even a CT scan is not open to me, and that's just a big old donut. Just you get to a certain point, and when you've had enough medical malfunctions of your own, you just can't convince me, sorry. And I may be tough, but sometimes certain things just get in your head and you can't get them out. So Britney, it's Britney, bitch. That's what it is. So time to go out there and get some good medicine and give some good medicine. Thanks for being here.